Hello, I'm Deepika Yadav and I'm presenting our paper, Should I Visit the Clinic? Analyzing WhatsApp-mediated online health support for expectant and new mothers in rural India. Transition to pregnancy and parenthood brings overwhelming changes, which significantly increases the support needs. This phase can become even more challenging when there are barriers from the infrastructure or society. Talking about the resource-constrained settings such as rural India, the basic access to healthcare is difficult because of the high overload of patients in public health facilities. One consultation visit with a doctor lasts less than 5 minutes. This leaves little scope to understand and meet the needs of expectant and new mothers. In this setup of healthcare, the recently increased ownership of smartphone by women in rural India opens new opportunities to think of designing alternative support mechanisms for them. In this study, we analyze one such initiative being run by an NGO in North India, which is using WhatsApp to design and provide digital support groups in the Haryana state. So this organization is providing stage-based guidance to improve awareness on the importance of first 1,000 days. And they have created multiple WhatsApp groups where they share educational material and interact with the group members. Since the project started in 2019, they have reached out to more than 3,000 families, and their team comprise 8 to 10 moderators, where one of them is a senior pediatrician. We analyzed 3 such groups, 2 groups of pregnant women and 1 group of mothers with newborns. We qualitatively examined their conversations and also applied social support theory lens. I would like to highlight here that our work contributes the intersection of social support theory, HCI, and maternal health, which is an understudied area in the sense that there is little empirical understanding that if support mechanisms are available for women in such settings, where they can freely access to professionals and peers, then what form of social support will be provided, sought, or maybe missed. In our data, the most frequent form of support seeking was informational support, and here it was mainly about consultation seeking on health problems. Within this, our analysis about the role of digital support groups observed 3 kinds of themes. The first is the ease of access to professionals through WhatsApp acted as a convenient first point of help. Women could freely share day-to-day anxieties and they could seek help in identifying symptoms and danger signs. This is important given that previous studies have reported that women delay care seeking more than men, and they may not have the resources or the agency to move out of the house immediately. The second theme was related to the use of group to compensate for ongoing treatments. One of the most frequent conversation in this category was related to the sharing of ultrasound scan reports, test reports, and asking for interpretation. And this pointed towards the barrier that arises in navigating healthcare because of the high use of technical jargons and English language, which is not the language for all. And contrary to some prior studies, we also observed some group members who actively ask the explicit explanation of the technical parameter of these reports. The third theme is related to the education support. Periodic discussion and updates of health parameters such as body mass index, hemoglobin levels, led to active participation of women in these groups, and they could also use the group to track their health and health of the baby and development of the baby. The form of social support, which is emotional support, was very less in these groups. The presence of the doctor was the major attraction for the group members, and everyone wanted to ask their query from the moderators or the doctor. And this points to the potential factors that might have affected the expression for emotional support. One of them could be the moderation of these groups. We tried to analyze this to some extent by comparing 2 groups at 2 different durations. In one of the groups, the doctor played the main role in initiating conversations around subjective topics, for example, how do you feel during pregnancy? But here, the conversation was mainly one-to-one, and group members replied to the doctor's question instead of having a discussion among themselves. In the other group, the doctor took the back seat and let the other female moderators encourage the group members to discuss among themselves. And this led to slightly higher number of peer-to-peer exchanges, but still overall it was less. And we also observed a missed opportunity related to moderation here. It is related to the topic and the environment that was created in these groups. Mainly, the focus was on fetus, infants, and their health rather than mother and her aspirations. The second factor could be the tool itself, because the NGO used WhatsApp to design digital support groups. The features were not supportive. For example, the privacy is not safeguarded. The phone numbers are revealed to everyone. And there is only one channel for communication with peers and doctors. Finally, in the discussion section, we discuss about the potential opportunities to supplement traditional healthcare from the design of alternative support mechanisms around certain themes such as measures for expediency. These kinds of services enable users to interact with experts in a lightweight fashion with little or no overhead. And this is useful given that scarcity of resources and professional is a known problem in healthcare all around the world, and people might not have immediate access due to various constraints. We also discuss about how can we extend the scope for providing clinical help. In these groups, we observed that the moderators did not shy away from participating in discussing the clinical cases that the group members brought, though on one hand, it also poses the ethical risk, but they allowed the group members to call them and seek help. And this aligns well with Hugh's argument, who analyzes online consultation forums and says that redirecting patients to see their doctor might not be the best strategy. And it then points to think about the relationship between providers and patient. And perhaps we can think about enhancing this provider to patient coupling to involve a broader set of providers. For instance, if there is a prescription given by a physician, then it can be authentically used by another professional for explanation purpose, a use that we frequently observe in our groups. Finally, in the end, we discuss about the trade-off that arises by taking a non-unplatform design approach that gives the benefit of reaching out to people in their familiar digital spaces versus using a bespoke application, which risks the adoption rate. Thank you very much. I would like you to read our paper for further insights. I'm happy to take questions.